Yes.
Okay, good morning, everybody. Welcome to our staff meeting for July 21st, Tuesday. Tom?
Good morning, Chairman and Commission. Kate, are you going to drive I want the dashboard up. Three things today, Commission. First of all, we'll have our COVID update. And with us today, as part of that update, is Dr. Minz. And also joining us on the phone at some point here between 9 and 9:15 will be Dr. Antonios, who's a medical doctor at Via Christi, and Dr. Lowell Ebersol, who is a physician at Wesley. Could be possible that we have Dr. Hagan join us as well. She's an infectious disease doctor, I believe, at Wesley. So they'll join us by phone. Dr. Minz is here in person. We will go through the dashboard here as soon as Aaron gets us up, or Kate gets us up. And then Tim will talk about testing and the status of any delays or issues with testing. And then, do you need this?
Yeah, sorry.
Sorry. And then second on the agenda today, Mr. Bennett is here from the DA's office. He would like to talk about court space issues, a continuation of the discussion that we had with Judge Gearing last week. And then if we have time, we'd like to talk about the state lobbyist contract and what the will of the commission is on that, but there's no hurry on that, so if this runs long, we can delay that till next week without a problem. So with that, let's go through the dashboard very quickly here. And just look at the 3 or 4 slides that I think are germane to kind of give us an indication of what's happening with the virus. So this is the first slide on our dashboard, which talks about total testing. It talks about the number of positive COVID cases. And the key indicator on this is a percentage of positive cases to the total number of tests. So as we see that number continue to go up, essentially 12 people out of every 100 testing today will be positive for COVID. And you can go back and look in the early June and see that we were averaging between 1 and 2 per 100 were testing positive for COVID. So as that number continues to go up, to me, that's an interpretation that there's more infection out there and it's permeating society a little bit more, as you can read out how you want, but the number continues to go up. It's not letting me page, Kate, can you? There we go. This is the new hospitalization slide. I want to talk just a minute about this one because we've changed it. This is the 4th iteration of this page. And I'll give you the history of the evolution of this page. When we first, in March, started talking about COVID and we had conversations with the hospitals, we were trying to get a capacity number or capacity level for the hospitals regarding ICU patients and vents. During that discussion, the hospitals talked about a number between 150 and 200 of their total capacity combined to handle ICU patients, and that number is kind of always stuck in my head. Then we put on this particular page some KDHE numbers that talked about hospitalization, but it seemed like there was some inconsistencies or some lag in that. So about a month or so ago, we tried to create a local page so we could look at data just with Sedgwick County. And then when we had discussion a couple weeks ago with the hospitals, particularly on June 29th, which was the very first date that we tried to put this kind of data up there, they had indicated a number of about 35 COVID ICU beds available. So that became kind of a number that we stuck with for the June 29th and July 6th meetings. And then on July 13, when the number of ICU patients went up to 27, that number then became 8, and there was 2 caveats on this website. First of all, it's an approximate number because the hospitals change it as they're managing their patient load daily. And also there was a caveat that both hospitals had the capacity to create surge beds as needed. But as they created those surge beds, it would cut the ICU capacity down for the hospitals. That number 8 sent a lot of, the people focused in on that number as an exact number, even though there was 2 caveats on the website that indicated it was not. So we just ended up pulling it down because it was creating confusion. So in our discussion from Friday last and this Monday, we came up with the following numbers. When we took this off a week ago Thursday, when we took that down, I called Dion directly and told him exactly why we were pulling that down. So the Eagle article on Sunday, and I'll read it to you, on Thursday, the county removed from the dashboard the approximate number of available intensive care bed units. No explanation was immediately provided. That's not true. I talked personally with Dion and explained to him why we were doing that. So I'll leave that up to people to determine why that was printed that way. The numbers we have today, if you look at this, I'll just explain through. The green indicates COVID patients. The orange indicates patients in ICU. And the blue indicates ICU beds available approximate, because the hospitals can change this. The yellow dotted line across the top is total ICU beds in the community at the public hospitals via Christie and Wesley. And the 182 now represents total ICU beds in use. So as this graph progresses, you will begin to see a line along that top when we get second points of data. So this now will evolve, and it gives us local data for just Sedgwick County, unrelated to KDHE or national kinds of numbers. So there's my explanation on the hospital page. And let me see if I can get this to flip. Here's the other graph that I think is important. It talks about cases and recoveries, and we can see that we still have cases coming faster than recoveries. We talked a little bit about this last week. Still a number going in the wrong direction. And then here's our active cases in the community. One thing about data, any government data, just remind you that these are cases reported to the government. These are cases reported to the health department. No one in any way, stretch of the imagination, should say that this is all the cases in the community. These are the cases that are reported to us, which is the best we can give you back in the way of data. So that's our dashboard. Any questions or comments?
Commissioner Cruz.
Thank you, Chairman. I received a couple of emails along the left-hand side, the percentage of change, also the new. So under cases, it's 2766, but 129 new. Is that because that was yesterday's data?
This data is changed every 2 days. So it changes on Monday, Wednesday, and Friday.
Okay.
And it will represent the change of those 2 days. And then over the weekend, of course, it goes from Friday to Monday. I'm looking at Adrian, right? Okay,
so the cases that are total case count and then the active cases, why are those two numbers different?
Because you take the cases
minus the recoveries,
minus the deaths.
Okay.
And one thing, there was a little bit of confusion yesterday, even on this case count. KDHE is showing us with over 3,000. We measure a little bit differently, and I'll let Adrian talk to that when she gets up. But these are definitive positive cases within Sedgwick County. It does not include PUIs. It does not include antibody testing, because when we have a positive antibody testing in Sedgwick County, we send them then for a nasopharyngeal swab to get verification that it truly is COVID. Then it goes on our sheet. I don't think the state quite measures it that way. So their numbers have always, from the beginning, been slightly escalated versus what we see on our website.
So then the recoveries that we're showing here, 1,000 people, a little over 1,000 people that have recovered. Do we have any data, or could we, and I've asked this a couple of times on the hospital calls, about how many people have been readmitted, or what are now some of the symptoms that these 1,000 people might have had, are experiencing now compared to what they were experiencing before, if anything at all? Because we get kind of hung up on this hospital data, right? We get hung up on beds available. But I've been saying from the very beginning that we don't know what this is going to do as far as long-term effects for people who recover. And I'd love for someone to speak to that, and maybe you guys will.
I think Dr. Menz wants to talk to that, Commissioner.
Perfect.
When he comes up.
Thank you.
Questions on the dashboard I could answer. Very good. Tim, you want to talk about testing then?
Oh, sorry about that, Commissioner Howell, my apologies. Yeah, thank you. Sorry again.
I just wanted to say, number one, thank you for hearing the concerns about the dashboard and trying to fix things. And
Work in
I know it's been
progress.
frustrating to try to get this in a position that is understandable. And I want to say thank you for your work on this. But I do want to also commend the hospitals for finally disclosing that they have 208 ICU beds. And that's just at the two hospitals, is that correct?
That's correct, sir.
Okay. 208, and we have 31 between the two hospitals that are in ICU currently.
No.
Page it back up here.
I know they have
That's correct as of Monday,
182
sir.
total ICU beds in use, but 31 COVID patients currently.
31 COVID
And
patients.
that's just at the two hospitals.
That's correct, as of Monday at 11 o'clock.
All right, well, thank you for that data. It's been something I've been trying to get for quite a long time. I want to say,
Yeah.
I appreciate all of the people who've made that happen. I want to say thank you very much.
Okay.
Hey, Tom, I thought Monday was more like 58
That's
Or-
58 total patients, sir.
total
31
patients.
in ICU.
Oh, I'm sorry. Thank you for clarifying. Thank you. Also, I see at the very bottom left-hand corner, there's 45,000 people have been tested out of our 500,000 in the county, so we're approaching 10% of all citizens being
That's correct.
tested.
And remember, that's from the get-go. I
Right.
mean, that's total cumulative number.
Right. So less the 2,700, so we have 42,000 people have been tested and are not symptomatic or not.
Right, so read this data. First of all, there's a lot of data. If you're on national news at all, there's a lot of conflict of CDC data. That's why we're trying to focus this page, this website, on Sedgwick County. Because as the Board of Health of this county, you have to make decisions here. So we're trying to really focus this to our county, and don't know what they're doing in Texas, don't care. I mean, I do, but for this page, it's for this county. And also remember that this is reported data to government. And any government data, it's important to remember that because there are people out there who have COVID that haven't tested. And so we can't account for that number because we don't know it. So this is a snapshot of what has been reported to government.
Right. Commissioner Cruz has a comment,
Thanks.
question.
So on the call on Monday, there were folks in our community, in our hospital system that, I'm trying to find the exact counties. We had a couple of out-of-county folks who are in our hospital system right now.
Correct.
The deaths that are reported on this page, are they any death of any person who has died, regardless of county, or just Sedgwick County
Just
deaths?
Sedgwick County, ma'am.
So has there been people pass away in our hospital here in Sedgwick County, but reported in a different county as a death?
I would have to ask the hospital that, but I would say probably that is true. Death numbers on this board are Sedgwick County residents. To Commissioner Cruz's point, I sent the board a synopsis after the hospital meeting. There's a number of patients in our regional hospital system that are not Sedgwick County patients. So these numbers that you see on the bar graph, when we look at and we see 58 COVID patients admitted into the hospital, that is total patients. That's some Sedgwick, mostly Sedgwick, but some outside of the county as well.
Yeah, Sumner, Pratt, Kingman, Ford, Cowley, and Marion County.
In Oklahoma, I think.
Yeah, and
Yeah.
one from Oklahoma.
Right.
Yeah. So that's another point. I think it is important to make sure that we continue to reiterate, because this is a regional hospital. We take care of the region.
I
It's more
think
than-
the point of this slide, and remember, there's lots of slides you have to be looking at. It's not just a single point of contact. The scope of this slide talks about our capacity of our regional partners here in Sedgwick County to handle patients and to manage. That's what this slide gives us. And it doesn't matter who's filling the beds, it reduces capacity when they fill the beds. So that's the takeaway from this particular slide.
Thank you.
Okay, I think that's it, Tom. Thank you.
Tim?
Good morning, Commissioners. Tim Kaufman, Deputy County Manager. Give you a brief update about our testing efforts, and then we can get to Dr. Menz. Last week, the health department tested 1,141 individuals. I think that may be a weekly high. That included a successful move from West Central. We moved our drive-through testing site from West Central to the Edgemore site, and we got that up and running on Thursday. It is a much better set of conditions for our staff in particular. Today's going to be a little bit cooler, but they've been working in that tent environment when it was 100 degrees and pretty hard on staff. And so the new environment is going to be better for staff to allow them to continue to deliver this testing service for folks. We have capacity right now for over 11,000 tests. We've got kits available. We'll continue to use those. That number has been diminishing. We continue to order. We receive fewer kits each week than we use, but we've got a stockpile available. And we've been through the process now with our consultant, Whit O'Brien's, and have the materials that we need so that we can execute a purchase order today for 2 testing devices, so that we will be able to, when those arrive and we get them installed, we'll be able to test about 550 samples a day in our own lab, and so that will reduce turnaround time pretty dramatically. We won't have to send out to national labs or the labs that we've been using within the state, and so that will help a great deal in processing these tests more quickly. So that's my report. I'd be glad to answer any questions you may have.
Tim, I don't see any questions.
Okay.
Appreciate them.
Thank
Thanks for the move to Edgemore. Thanks for that update.
I'm going to turn it over to Dr. Menz.
Okay. Good morning, Dr. Menz.
Morning. It's always a good morning when you have a nice gentle rain in July in Kansas. It's wonderful. And we feel like the temperature won't be over 90 degrees today. That's a red letter day in Kansas. So, well, thank you, Gerald Menz, Health Officer for Sedgwick County. Appreciate the update we were given on the numbers by Mr. Stoltz. I'd like to just add to that. We were pretty comfortable at the end of May. We thought we had done a good job, and I think I remember commending the community and commending our citizens for helping us get the numbers under control. Last week in May, we had 45 new cases. We had 8.7 new community cases per 100,000 residents, and our percent positive cases was 1.9%. We thought that was pretty good, and we decided that maybe as a result of those numbers being pretty good, we could lift most of the restrictions and hope that the community would continue those habits that would keep those numbers down. We now move the clock up 6 weeks. We now have 529 new cases per week this last week, 103 new cases per 100,000 population, and a positive case rate of 11%. We had all hoped that this virus, like influenza, did not like hot weather, and that this virus would be less common as we got into the warmer weather. We thought this virus would behave more like influenza, another major respiratory virus. We were optimistic. We also thought the community would continue to practice those concerns we had, practice those habits that we suggested they practice to keep the transmission low. As I've said many times, this is the first time we've been through life with this virus. No one in the world has ever been through this a whole year. So we're all learning as we go. And what we have learned is this virus loves warm weather. Unlike influenza, it just works. It is transmitted very effectively in hot weather. This virus does not take a pause in the summertime. We also learned that the public, while very cooperative in the early part of this year, were ready to get out, ready to enjoy the holidays. And so we think those factors in combination have led to the virus having a very successful time in infecting a lot of people. I mentioned the percent of positive cases because, again, as you know, the number of tests we do per week varies, but the percent positive tells you how many people in the community per 100 people have got the virus, and it's gone up tremendously. Our numbers have gone up tenfold in 6 weeks. So I feel very strongly we need to do what we can to get this thing back under control, at least move it towards where we were at the end of May. I think if we want the schools to go back in session, whether it's August or September, we need to get the cases down. While I understand that kids don't seem to get quite as sick, we're not sure yet how effective kids are at transmitting it. There's some early data that says maybe not as effective as adults, but we're still learning about this virus. And obviously we have adults in the schools who are very susceptible to this virus, and I think they're very concerned about going back. So I think that's a major concern. Our hospital numbers, you've heard, are at their high water mark. We have more patients in the hospital today than we've ever had. We have more employees at our hospital who are sick and at home with COVID now than we've ever had. And that is a major component of the hospital's ability to take care of these patients and other patients. When they have a number of staff members who have to be isolated or quarantined, that affects their ability to take care of these people. And I can tell you, I know this epidemic has been very stressful on a lot of the healthcare providers, and it continues to be, and we all see no end in sight here. I'm optimistic that we'll have something more effective to help us control this virus by December, but that is optimism again. It's not a guarantee. Some of the data on the new vaccines that are coming out look positive, but those studies are all in a limited number of patients and not a long-term data. So while I'm optimistic, don't think we can put all of our hopes on that. Sedgwick County, as you know, or the state of Kansas, you know, is now a red state. It identifies one of the states that has many more cases than they had, and that other states may have some questions about people coming from our state going to those states. Doesn't make me happy. We had thought early on this was a disease mainly of the elderly, at least in terms of mortality, but with this recent increase in cases, we're seeing a shift towards a younger population, and that probably is mitigating the fatality rate, but I can tell you a number of those patients are very ill, and they have a very long hospital course, and I can't tell you what their follow-up is, because after they leave the hospital, they go to their primary care providers, and that's a number of primary care providers, and I don't know of any systematic way of collecting data, at least from a public health point of view, on how they're doing in their follow-up and their recovery. But I'm sure a lot of those patients are going to need to have some rehab and other things. And as you know, we've learned that this virus is not just a respiratory virus, it's a systemic virus. It affects all the organs. It affects young people having strokes. This is something new. We didn't even know about this when the virus first came, but it creates a clotting problem in many patients. We've learned to start treating that with anticoagulants, but it's not 100% perfect. So we are seeing patients that are having cerebral vascular accidents, strokes, because of this condition, and other organ damage. So it's not just a respiratory illness. Some of our long-term care facilities have been doing a better job, not having the clusters, but some of those have had cases in their staff, not just their patients. And again, that affects their ability to take care of their patients. So as of Friday, 82% of Sedgwick County cases were younger than 60 years of age, and as of Friday, 55% of Sedgwick County cases were younger than 40 years of age. So it's not just a disease of the elderly. It's affecting a number of age groups, and it has moved down and affecting more of the younger people than it had when we originally saw the cases last spring.
Doctor, can I interrupt for a second?
Sure.
What were those last two figures? Percentage under?
As of last Friday, 82% of Sedgwick County cases were younger than 60 years of age, and as of last Friday, 55% were younger than 40 years of age. So that's a significant shift from more of an elderly population in the spring to now, as we reopened and the summer months came and holidays came, we're seeing more cases in that younger cohort, which, if you remember the pictures of the parties on Memorial Day in the Ozarks, it was mainly a younger group. And we presume that's probably why we're seeing more cases in that group. Now, again, we're learning about this virus. A lot of it's presumption. It's not proof. And as you have probably read in the press, there's so much in the press, the White House Coronavirus Task Force is calling many of the states that are seeing these increases to consider moving back into our restrictions from phase 3 to phase 2 to phase 1, back to some of the restrictions we had earlier. I know that we have a number of McConnell servicemen who have the infection, and that again is a younger population. I think that the mandated mask is working. My informal survey shows a lot more people are wearing masks than they did before the mandate. I think the mandate is important for getting a hold of this virus, but I don't think it is the end result or the only tool we need to use. And I hope that we can see some mitigation of the number of cases here in the next few weeks, now that we've had the mask mandate out for, I think, 3 weeks now, although it took a little time to get the population to adhere to that, but I think we're doing pretty well with that. But I think if we really want to get our numbers down further, we want to make it a little easier to open the schools, that we need to write an order that incorporates a few more restrictions. So I suggest that I'm asking to create an order for the bars and nightclubs to be closed for the time being. Other drinking and eating establishments that serve alcohol will be asked to close at 10 p.m. In the order, I'm suggesting that we cancel all fairs, parades, and festivals. I am not making any recommendations regarding our schools. I'm recommending that the gathering order be limited to mass gatherings to 15. The venues with a capacity of excess of 2,000 people be prohibited. That businesses enforce a social distancing of 6 feet between patrons of people who are not close acquaintances or household members. And none of this affects schools, licensed daycares, or summer camps or religious institutions. So those are the further additions to the order that was made earlier to hopefully start getting the numbers down and getting control of this virus. I'd be happy to take any questions anyone would have.
Okay, thank you, Doctor. Would you care to, you had about 6 or 7 points on a new order. Could you repeat those?
Sure.
So,
Bars and nightclubs are closed, and other drinking and eating establishments are asked to close at 10 p.m. or ordered to close at 10 p.m. Mass gatherings be limited to 15 people. Venues with a capacity of excess 2,000 people be prohibited. Businesses are required to maintain a 6-foot distance between patrons that are not of the same household or close acquaintances. No fairs, parades, or festivals. But nothing of this order would affect schools, licensed daycare centers, licensed summer camps, or religious institutions.
and you, is there an assumption that masks are still part
Yes,
of
the mask order will still be in
It's
effect.
still in effect? Okay. Thank you for repeating those. Commissioner Cruz?
Thank you, Chairman. You said that, are you giving a date? Are you giving a time frame?
I'd like that, the order to be written and signed this afternoon if I can.
Okay, so but the time frame for,
It'd be the same time frame as in the other order. I think it was September 9th or something like that.
okay, September 9th. So all of these additional restrictions until September 9th.
And then we'll have to, as we
Reevaluate.
get closer to September, we're going to have to reassess and see where the numbers are at.
Okay. One real quick thing outside of this order. Thank you for giving that to us today. I just had one quick question around ICU stays. How much do those cost?
I think that question should be addressed to the hospital people who might be on the phone, if they're on the phone.
Okay, and I didn't necessarily think that you would know the exact number, but I think that we all kind of could gather they're pretty expensive. So all of those who are in ICU right now or in the hospital, the younger age demographic, I wonder how many of those are without insurance or are struggling to pay for this. So I think that that's another thing we should probably take into consideration. Can you speak to that a little bit?
Well, I think, I don't have any actual data on that, but I'm sure that a number of those patients, as you know, we have our unemployment rate in this community is higher than it's been for a long time. And with unemployment, often people lose their employer-based insurance. So I'm sure some of those people are going to struggle with paying their hospital bills.
Okay. Well, thank you for being here today. I appreciate you giving us these further.
You've asked me in the past about aerosols, and I just want to let you know there's some new research that's just come out from South Korea that suggests that aerosols are certainly important in the hospitals where we're doing procedures and there's lots of body fluids getting into the air. So that's why we're so strict about in the hospital having full protective equipment and N95 masks. But there's also some limited data coming out suggesting that aerosols might be important in people who are in very densely populated areas with poor ventilation. So there's still emerging data on the role of aerosols, but we think in normal interpersonal interactions, it's still the droplets in the mask are probably still the most important. But there are some settings, hospital settings, and possibly others where aerosols may be important, but data's emerging. Other questions?
Yeah, Doctor, could you weigh in? I think you're a part of helping us on. We're trying to get as fast as we can to rapid testing. So this is a little off the.
Yeah.
So we know the nasal, but now there's this. Do you know? Can you speak to is the saliva potential or even I've heard maybe deep breathing, such as alcohol breath analysis stuff. But anything that because we continue to have delays in the outcomes of
Sure.
the tests.
Oh, that's very important.
And we're working so hard for and I know staff, and we've got the CARES money, we've got a lot of ideas coming at us. Can you
Sure.
give us a comfort zone on where you think we're at, or?
So the current gold standard is the nasal swab, which is a little uncomfortable, but people tolerate it. And there is a rapid test for that. You can get a result in 45 minutes. Unfortunately, the machine that does that, the suppliers had great difficulty supplying enough kits. There is a hospital in town who has one, but they can only get about 90 kits a week. And
Okay.
again, it's another example of why we're so paralyzed with just the inability to produce enough things. There are companies looking at saliva, and there's some preliminary data suggesting saliva may be as good as the nasopharyngeal swab. My biggest problem with looking at those studies, they haven't been validated against the nasopharyngeal swab PCR test yet. I've read some of the literature of those companies. It sounds promising, but in medicine, you have to show that you're as good as the gold standard before we'll accept it in terms of making patient care decisions. And I just haven't seen those data yet. I've mainly seen what the proprietary company's data is. Nothing against that, but sometimes the proprietary company data is not as, doesn't bear out when it actually gets out in the field. So we're hopeful.
Do you feel that, I've got some messages up to Topeka, do you feel that Dr. Norman Lee and even our other population area up in Johnson County, are we working on similar paths, or is everybody trying to do their own thing? And then I'm hopeful that locally in Kansas somewhere, be it here, I don't care, Lawrence, Kansas City, Topeka, somewhere, that we can do this 45-minute result world. But
That would be nice. The machine I told you about that we have in town, unfortunately, if you order it today, you can't get one. I mean, the companies are so backward. I think everybody in the nation is putting in orders for these machines that now exist. And that's why they can't supply enough testing kits.
okay.
I know the health officers in Wyandotte and Johnson County. We are having a every 2-week meeting of the health officers in the state that wish to participate.
Okay.
So we're making attempts, but unfortunately, most of these saliva tests and these other tests that you hear about, they were allowed to come out on an FDA emergency proposal, meaning the FDA has not tested them yet. And they're letting them out early just because there's such a need, but they're also saying this is a preliminary. Until we see some hard data, we're not going to make this release permanent.
Okay. Well, thank you. That's helpful information. Commissioner Dennis.
Thank you, Mr. Chairman. Well, good morning, Dr. Mintz.
Morning.
Thanks for being here. We appreciate it. We appreciate your recommendations. One of the questions I always have deals with schools.
Yeah.
I know that the state board is going to be making some decisions tomorrow. One of my concerns is we have the largest school district in the state, and we also have a number of very small school districts in the state. And so I guess my concern is a one-size-fits-all solution to all of the different school districts that we have here in Sedgwick County. And the superintendents are reaching out to us as the Board of Health and the health officer and the health department. And we're going to have to wait until tomorrow to see what the state board comes up with. But I don't know about one size fits all. I know that the governor has asked for masks for everyone. Do you believe masks are needed for the elementary school students?
There is data that just came out from another country that looked at kids and how important they were in transmission in families. And at least the data on this one paper, and in medicine we're a little reluctant to accept something just based on one report. We'd like to see it be confirmed. But kids less than 10 were not very efficient at infecting the rest of the household, much less efficient than adults. After age 10, the kids start approaching the adult efficiency of transmitting the virus from one person to the next. So there is some data out there suggesting that age 1 to 10 probably aren't a major component of transmitting this disease, and maybe a very, very minor component. That's promising information. I'd hope to see some confirmation that was not a study that was done in the United States. Doesn't mean it's wrong. It's just I'd like to see some more data. But there is some hopeful data coming out that maybe the young kids less than age 10 don't need masks. We'll see. But again, we're only 6 months into this disease, and we just haven't had time to do enough studies to make hard decisions.
Well, I appreciate any kind of help or guidance that you can help us with. We're going to talk to the superintendents again later this week, and we need, as a county, to be able to tell them what we can do
Right.
to help them open schools safely, whether it's in September, whether it's yet in July or August. I'm not sure what the solution is, but that's why we're going to rely on you and the experts to help us make and provide sound recommendations to our school districts on how that we can get students back into the classrooms safely, but not just the students, but also the faculty and everyone else that's involved in the school districts.
Well, so you know, I met last Friday with a number of pediatricians in town that are working with the schools to help them give advice, and we discussed a number of the things they're suggesting. I also believe on Thursday of this week we are meeting with a number of the superintendents, and they've asked us to meet with them. So we are trying to do what we can to help them make their plans.
Very good. Well, I thank you for everything. I look forward to seeing what kind of solutions we can come up with schools.
Yeah.
Thank you.
Thank you. Commissioner Cruz.
Thank you. Just two things. There's been so many mixed messages between different counties. I, for one, have a child that I split with my ex-husband who lives in Montgomery County. And so she comes from my house to his house. And so that could create a challenge between different governments doing different things. So I really want to point that out because I know that I'm not the only person in this county or in this state who probably has that situation. The second thing is the hospital tests. They mention weekly, and please correct me if I'm wrong, about the tests that they have a 2-hour test that comes out. Is that the Abbott machine? What test then can they do in our hospitals that's a rapid test that can be done in 2 hours? And what's the efficiency of it as far as false positives or false
Well, the
negatives,
test
excuse
is-
me?
The test I referred to is not Abbott, it's a company called Cepheid, and it's felt to be very accurate, but the problem is they just can't get enough of the testing kits. The machine they have, but you need little kits that the swab goes into and then you put in the machine. And the supplier's just not able to meet our demand. I don't know what the other hospitals have, but I also know they've had trouble being able to do the volume they would like on the rapid test. And they've had to send out the other tests to the outside labs, which have been overwhelmed because so many people are sending them swabs to be tested, they just can't meet the demand. So some of those companies are up to 8 days before we get a result back.
They're probably keeping a stockpile of those that come through their ED departments for
I-
those who,
yeah.
because
I-
they talk about it each week, about
Yeah.
being able to test folks quickly
Mhm.
and then are admitted into the hospital. Correct me if I'm wrong.
Yeah, let me, Commissioner, let's take this opportunity. I don't know if the doctors are online or not. I have not heard them beep in. Dr. Antonios or Dr. Ebersol, are you on the line?
This is Dr. Ebersol. I'm here.
Dr. Ebersol, are you hearing the conversation here okay? Or I think Commissioner Cruz had a question about testing that the hospitals are doing, that you're getting some rapid results back. And then while you've got the floor here, you can talk about anything you want as far as hospital operations or any comments you'd like to make right now to the Board of Health, please.
So in regards to Commissioner Cruz's question, we have 3 testing platforms at Wesley that we're able to use. We're fortunate to have those. We have, all would be considered, one is definitely rapid. It's a 15-minute Abbott device. And that has, in the literature, report a false negative rate of around 10 to 15%. We use that when we use that in limited situations because we have the 2 other platforms that we have are Cepheid and Disorian, and those have a 95% confidence, so a much lower false negative rate. And so we, with our lab director, we have a process where, and those take about 45 minutes to an hour to run, so we can have pretty quick results on those as well. So we preferentially like to use those devices as much as possible due to we have much greater confidence in those results. So that's been our practice at this time.
Dr. Antonios, are you on? Or Dr. Hagan? We have one doctor.
Okay.
And what's the name of the test? I mean, what's the name of are we buying any one of these machines? We're buying an additional machine on top of these.
I'm not aware of what the plans are for buying additional machines.
What? This is a complicated subject matter, so thank you for explaining it to us all.
The machines that we are going to purchase today are they're called a Hologen Panther. They will allow us to do the nasopharyngeal tests. We are still evaluating some of the other high-speed options. We are continuing to look we know that testing is going to take a broad array of different solutions, and we're looking at some of those high-speed ones as well.
Okay. Commissioner Howell.
Thank you, Mr. Chairman. Dr. Mintz, thank you for being here again
You're
today. Looking at some of the, some of the things that you've outlined, some of the details of the order that you'd like to see. You say gatherings over 2,000. Is that an indoor event only? Is that outdoor as well?
I think it was any venue that has over 2,000 people, whether it's an auditorium or a sporting event.
I think when we were discussing this, the key was people who have to sit in a chair for a long period of time to observe an event or a situation, be it inside or outside. Things like outdoor activities where there's a transitory public the zoo, automobilia, those types of things where people are moving and continue to move. I don't know that that was the focus of this. We can refine that. I don't know if Justin or Mike want to talk about how that can shape up in the order. We'll refine that
Well,
further.
just for clarity, automobilia is one of those things that there's been questions about. I'm sure you're aware of that. I'd like to clarify how we're going to deal with that specifically, because I want to just put that to bed. It's happening this next weekend. And if I understand correctly, it's an outdoor event. It's people moving in groups. I assume social distancing is mostly going to be done. It's going to be outdoors. Is there any problems with automobilia going forward?
I don't object to it going forward. I think that's a little different than having people in a stadium. They're sitting there watching a football game, shoulder to shoulder, turning, shouting, cheering in each other's face. This is a little different. People are probably in pairs or small groups of families moving around. So I think that's a much different situation.
I know it sounds crazy to even talk. So again, I think, so to end that conversation, it sounds to me like automobilia is okay.
I think we can accommodate that because of the different nature than what we're talking about in terms of people sitting in stadiums or bleachers.
Okay. So back to that type of event. So let's talk about a potential baseball game. I know there was no plans for one that I know of right now, but I know that's been something that's been talked about a lot. When are we going to be able to see the new stadium used? And so, for example, if people were sitting in groups of 15, according to your order, and they were distant from other groups of more than 6 feet, and they were known to each other, and they were all wearing masks, is there any reason why that couldn't happen?
I suppose that's possible. I don't know if they can get 2,000 people in there with 6-foot distancing, but we would at least look at it.
But even if they had 2,000 in that situation, since it's outdoors,
Yeah.
I'm trying to figure out the details exactly how this order.
Well, I think outdoors does have some advantages, but still, if it's transmitted mainly from person to person with close contact.
Right.
If you don't have a mask on, you can still give it to someone, whether you're outdoors or not, if you're sitting right next to them.
Okay, I would agree with you. I think the masks have been worn pretty well.
Yeah.
I've compared inside Wichita that has an enforcement option, which I don't think has been used yet that I'm aware of, compared to outside of Wichita. And I think that, again, anecdotally, it looks to be about the same amount of mask wearing. So I think right now, what we're seeing, I think, is people who are willing to wear a mask, whether they have enforcement penalties or not, are wearing the masks, and some people are just are not willing. And that's the same numbers are inside of Wichita versus outside of Wichita. Would you kind of agree with that a little bit?
Well, I've tried to observe the travel restrictions, so I haven't been outside of Wichita very
Okay.
much.
Well, I live in Derby, so I've been to
Yeah.
I've been to
Yeah.
some of the stores in Derby versus
Yeah.
Wichita, and I guess my opinion is it's about the same. So I just want to, if somebody wants to go out and measure that, it might be good for us to know how that actually is being done, because in my opinion, I can't really tell a difference from inside Wichita versus outside Wichita. I'll just say that. And
So I might add that Walmart and Dillon's, Kroger, and I think Best Buy are now mandating you don't come in the building if you don't have a mask on, which we didn't, that's not in the order. But it's good to see them following through with it.
Well, so I guess since it has been about 3 weeks since these orders have gone into effect, are we seeing some type of, I know that it takes up to 3 weeks or so,
Yeah.
but certainly we've seen some type of impact of the order by now, would we not?
That's
Able to
always a difficult thing to ask because I think the last 2 weeks, we've seen maybe the numbers high, but they're plateauing. Now the question would be, what if we hadn't done the order? And that's an impossible thing to answer. If we hadn't done the order, where would the cases be now? Would they be up to 7,000 rather than 5,000, or it's 500, 700? Don't know. It's an impossible question.
Looking at the hospital numbers that we had earlier, have the hospitals considered any type of changes in their normal operations of the hospitals by maybe not doing elective surgeries? Has that been something that's been?
Again, I don't sit in those meetings.
Dr. Ebersol, are you still on, sir?
Yes, I am.
Did you hear Commissioner Howell's question?
It was a little bit difficult to hear. If you could repeat it,
Okay,
please.
Commissioner Howell is asking whether the hospital is reconsidering any hospital policy concerning elective surgeries or other kinds of business operations due to the increased numbers of COVID.
Yes, we've been discussing that. We have plans, we have surge plans in place or to put in place for in the event of for to continue elective cases, and then to also have plans if we were needing to scale back to where we would not be doing elective cases again. I'd be remiss. It's a common thing that is discussed. Our surgeons have asked about it. We talk about it frequently, but we are not at that point right now. I would just kind of reiterate, as Bill Volich has described, I think many times on our Monday calls, that it's a dial. It's not an on-off switch, but it's going to be a dial, and we will, we're constantly evaluating that on a day by day at the very least, if not, multiple times throughout the day, looking at our capacity and how many patients we have in house. But there's a lot of planning that's gone and has gone on for that, and we can implement a variety of different plans depending on how what the future holds.
And I think Dr. Antonius, are you on now from Via Christi?
Yeah, I am, and I apologize for being late. I was preoccupied with something else. I think I caught your last question, Commissioner, and that's regarding elective surgeries, and similar to what Dr. Eversole shared, it's something that we have discussed and have evaluated, but we haven't really reached a point now where we have decided to move forward with doing any change with elective surgeries. I did want to mention that, that word is a little bit misleading, and it's been now well described that it's somewhat misleading to think of all surgeries as something as scheduled as being elective. There's a lot of conditions that may be scheduled at a preset time into the future. However, based on a variety of clinical conditions, they're really not something that can be postponed safely a lot of the times, and there is evidence now during the first phase or the wave that we have gone through of COVID-19 that we have seen somewhat negative impact of cases that were postponed out of obviously the concern early on of PPE availability, which now you realize that they probably shouldn't have been delayed that much just based on the outcomes, or based on obviously the fact that, like I said earlier, the word elective is very misleading, and we have to be careful. But to answer your question, it's something that we look at all the time, but no movement or change at this point.
Thank you for the answer, Doctor, and Dr. Menz as well. Just want to say that this is one of the things we do have some control over by simply making a policy choice. So as hospitals continue to struggle with not as much staff as they would like, and maybe more beds full than they would like, this is one of the things they have some control over. I just thought to throw that out there once again, that should be on the table of things that are being discussed, I guess, along with these other community restrictions. Do we continue to have, if you will, an application or a review process for large venue events? I mean, say someone wants to have an event that is on the edge of these things here. For the last few weeks, we've had some of these things have been brought up to Dr. Menz or someone for some kind of a cursory approval of that. Is that something that's going to continue?
Well, certainly if we're approached with questions about those events and what we would suggest in terms of making them possible, we always are available to answer those questions. I don't know if there's any formal application process.
No, there's no formal application process. It's just to answer the questions as best we can and give guidance. We'll see what the order looks like that Dr. Menz is crafting today with Justin, and then we'll get the Board of Health a copy of that order so that we can all interpret and decipher that together.
Okay. I'll be wrapping up my comments in just a moment. I would just say that other states that have had mask orders, they have recognized, at ages 10 and below as not needing to wear masks. And I think as I observe children trying to wear masks. They play with them constantly. Sometimes they wear them on the back of their heads or below their chin or on top of their heads and things like that, or they're not wearing them at all. You're talking about elementary school children, and I think for these a mask order is almost a distraction from what they're trying to do in schools. I guess I'd like to see that considered seriously. I know the science is out there. I've been listening to many sources in the last few weeks, and it seems like there seems to be a prevalent opinion out there by many medical experts that ages 10 and below, really, the mask wearing is not that beneficial. It may not have any impact whatsoever on these children contracting or spreading this virus. And so I would like to see that age changed from age 5 to at least to age 10. So at least elementary school age children up to grade 5 could be exempt. Would you agree with that
I
or
would
disagree?
consider that. Like I said, there is a paper out that suggests that, not just anecdotal information, but actually a study was done. So that just came out this last week or two. So I think that is new information that we should take into consideration.
Thank you. Mr. Papoon, I don't know if you're willing to comment on this or not, but Governor Kelly yesterday spent quite a bit of time talking about whether or not county commissioners could, in fact, impact or influence or approve or veto these types of orders coming from the governor regarding schools. Can you please confirm or elaborate on that just a little bit so we know what our authority is here?
Commissioner Howell, Mike Papoon, County Councilor. Justin Wagner and I have been looking at that issue the past few days. There's not a clear-cut answer, but at this point we feel that probably the governor's position is correct and that county commissioners can't interfere with that particular order because it's not in the same nature of a statewide order that some of our other executive orders have been. And even if we did, I think our only remedy, our only action probably would be to push this back to the local school boards or something. And those local school boards are under the jurisdiction of the state school board, State Board of Education, which is meeting tomorrow, and we'll know more after that point what that board wants to do. But I really don't think it's probably something that this commission wants to wade into at this point.
I will just share my heart on this. I think if we delay the starting of school, what happens in September when the numbers are not better? Are we going to delay school another 3 weeks to a month? And then eventually, I mean, it'd be nice to see our numbers get better. I don't know that we're going to want to undo the things that got us to the better numbers if that would happen. But if we don't get better numbers, are we going to delay school indefinitely? And I think that's a great question. I think we've got to understand there's detrimental impacts of children by not going to school. There's all kinds of social things that happen. There's not just the academic side, but there's all kinds of other. I don't need to go through the long list there, but there's all kinds of things that happen when kids don't go to school, and it has an impact on Sedgwick County's economy. And Sedgwick County's everything going on in Sedgwick County is impacted by our schools because it's such a big part of what we do here. And so I guess I would like to see this handed back. I don't know if Commissioner Dennis said this exactly, but I think the local schools ought to have control on this. We have 10 school districts, I understand, that are centered, they have headquartered in Sedgwick County and 10 school districts that come into Sedgwick County. So out of these 20 school districts that come into or are centered in Sedgwick County, I trust them. They're elected officials. And I think they ought to make the best decisions. We still have a very, very diverse state. And I think that to do this as a statewide order, in my opinion, is the wrong tact. We ought to hand this back to local school boards, and I trust them. My very big concern is I don't want to see a delay in schools. I think we ought to mitigate the risk the very best we possibly can. Do all the things inside the schools, which they've already planned for, social distancing and different hours and all kinds of things they're doing. I've talked with one of my superintendents, and they have a tremendous plan ready to go. And now this a quick decision to delay this has really caused a lot of problems for them. So I think delaying schools is the wrong way to go forward. And I would like to see the masks moved to age 11 and above, simply so elementary schools can not have to deal with this, because I think, frankly, it's a distraction from what they're trying to do. And then I guess that's my last point. I will stop with that. Thank you for your time. Dr. Menz, thank you, Chairman.
Commissioner O'Donnell.
Thank you. Dr. Menz, as always, thanks for coming. So the question, and I know you're not going to be able to get this answered right away, so I can have staff work on it as well with you, is I've had people that run private schools in Wichita call me and ask whose jurisdiction they fall under because they're not part of the state board of education. So would that be, do you know the answer? Is that something that we would handle at the Sedgwick County level?
I would defer to our legal experts.
Sorry, what, Commissioner?
Do we handle the guidelines for private schools, so private institutions here in Sedgwick County? Where would they fall under?
You know, I think that's going to be up to the governor and the State Board of Education, Commissioner. We really.
But if they're not public schools, the state board doesn't control.
Well,
If they're
I'm not prepared at
accredited.
this time to know how far the governor's order is going to go with regard to the smaller homeschooling or the unaccredited schools or these schools. We can try to look into that.
Yeah,
And get back
I
to
think
that.
that's a question we do need to get answered because Sedgwick County does have a number of private schools and a number of people that homeschool. So I think that's critical for us to
But
find.
in any event, I don't believe that Dr. Minz's order is going to affect these schools anyway.
I agree with that,
Yeah.
and especially the religious schools, because your order is going to exempt religious institutions, correct?
Doesn't affect schools, licensed daycare, licensed summer camps, or religious institutions.
Yeah. So I think this is a question we need to get answered sooner than later about what private schools are going to do because people are getting ready to enroll their kids, and I think the governor's order might impact the numbers of people that might go to a private school if they're concerned about public schools not opening. So anyway, that's something we need to have further discussion on. So thank you again, Dr. Mintz.
Okay, Doctor, I don't see any other questions at this time, so again, can appreciate and thank you, doctors, for being on the phone.
Dr. Ebersol and Dr. Antonios, thank you. We'll go ahead and hang up with you. We'll move on in the meeting. So thank you for your participation this morning.
So thank you for letting me speak with you, and I know this virus has caused lots of consternation and trouble for everyone in the community, and I know it's been difficult. We're still going to work on getting through this.
All right. Sorry, Doctor, we got one more.
No, this really isn't for you, Dr. Mintz. Thank you for your time today. It's really for our legal team. Can you tell us what the steps are now that he has given us his recommendation? What are the steps for this board? Can we just reiterate that really quick for everybody?
Commissioner Cruz, Mike Papoon, County Counselor. I believe the next step is for Dr. Minz to issue an order. This board really is somewhat restricted in what it can do on its own. It can issue a gathering order, and it has the authority, because of the House Bill 2016, to amend, revoke, whatever Dr. Minz does. So we need to wait till Dr. Minz issues his order, and then this board would have the authority to amend that or take other action as it deemed appropriate. But I don't believe there's any action on the part of the board until he issues a new order, or unless you want to amend his current order, which the board up to now hasn't shown any
Well,
inclination.
there was some concern the last time Dr. Mintz suggested something from some commissioners on this board saying that we should have taken action. So I just want to make sure that we're all on the same page of what we can do, what we can't do. Would that be, I think that's something that I'm glad you clarified that. So what happens now is Dr. Minz will issue this order if he believes it, and then if we think that we need to do whatever we need to do, then we'll have to have a special meeting to do that. Is that what you're telling us?
I don't know that if he issues the order today, I don't know that you would need a special meeting. You could have it at your regular board county commission meeting tomorrow. It would be an off-agenda item at this time, but you could do a special meeting. Or you could take no action at all and let Dr. Minz's order remain in place as it is.
So I guess, Dr. Minz, are you going to be issuing this order?
Yes, I am.
Okay, thank you.
Okay, thank you. Tom, we're ready to go. Next item?
I have one question.
Oh, Commissioner Howell.
Thank you. Dr. Mintz, before you head out, I'm sorry. I had just one question regarding you mentioned, I think it was that eating and drinking establishments would have to close at 10 o'clock. So this is not the same thing as a bar at night or nightclub. This is like an Applebee's, I assume, something like that.
The restaurant has a license to serve food as well as alcohol.
Okay, so so an Applebee's is a good example, perhaps. They have a alcohol
In my opinion, that
license.
would be the establishment we'd ask to close at 10.
If they don't serve alcohol, are they included? And so if it's a restaurant that doesn't serve alcohol, they serve food.
I would say they still should close at 10.
They close at 10. I guess I'm just wondering the rationale behind that, because I think that their customer count would drop off in most cases at 10 o'clock anyway. I'm not quite sure. For example, say McDonald's is open till 10 o'clock or versus 11 o'clock. Does it really make a lot of difference that they would need to have this included in the order that a restaurant will close
I'll take that
arbitrarily?
into consideration, although I think the population that's after 10 o'clock tends to be your younger population.
So this is an intent trying to keep the younger population
Well, we
from-
see the younger population being more affected recently, and we're trying to figure out why. And one of the things is they tend to be a little bit more likely to stay up late and eat and things like that.
Okay. So primarily, we're talking about restaurants and any place that serves alcohol, but it doesn't have to be
Yes,
both.
that's the
Restaurants
primary-
by
that's the
itself
primary.
is okay, but selling food is not the problem. It's just if you have a sit-down table where
Yeah.
you're served.
Right.
Okay. Just want to clarify. Thank you, Chairman.
I'm sorry, I have
Thanks
to
again.
leave and go do some
Right.
work at my other
Thank you.
Thank you.
establishment.
Okay. Ready, Paul?
Chairman, I forgot to mention in the introduction, Lindsay and Brent and Aaron had promised last week to give the commission a demonstration of the application process for the CARES money, and I think they'd like to slip in at this time and give that a demonstration for you.
Okay.
You ready? Good morning, Commissioners. Brent Shelton, for the record, with your Division of Finance. We've got a kind of a two-part presentation for you this morning. I'm going to visit for a little bit about process and timelines and so forth as we move forward from the go live yesterday from our online application portal to the time that I'll be coming to you on August 12th to make recommendations for your approval of CARES Act expenditures. So if you'd allow me, if we just kind of work backwards from August 12th, kind of what will be happening in the interim. On the 12th, like I said, that'll be the first of weekly meetings that would recur where we would come to you with the applications that are being recommended by the Financial Stimulus Review Team for your approval of those expenditures. And on no later than the Monday prior to each Wednesday County Commission meeting, we'll give you a packet of information. In that packet will be the current applications, the requests that they're making, information about that subrecipient or that grantee, that organization. And those will have been approved the prior Thursday by the Financial Stimulus Review Team. That's that group of 7 folks, 2 internal and 5 external people who will be reviewing those applications and those requests for funding. We're making a commitment to that group to get them information a couple of days in advance about the applicants as well as the requests that they're making. A little aside about that group, we're having our first official meeting with that group this Thursday, where they're going to be getting some training from BKD, one of our consultants, about avoiding conflicts of interest and how to communicate issues that might arise should they be asked by someone on the, maybe a potential applicant, when they might need to recuse themselves. We're in a big community, but we're also kind of a small community as well. A lot of people know a lot of people, so we want to make sure that our process is open, is transparent, and is devoid of any potential conflicts, whether they be real or perceived. So that training is going to be going on with that committee this Thursday. So the information that that committee would be receiving will be the stuff that's beginning to come in on the online portal. And those will be then subject to a couple of risk assessments. One is we're going to assess the risk of the applicant. We're going to assess the risk of the request. What we want to see in terms of an applicant is the level of fiscal governance. We want to see if they're subject currently to audit, if they've had prior experience as a grantee of a federal or state program. Maybe they've had some turnover in key staff. How big are they? What level of staff do they have? These don't disqualify them if they get answers that would make them higher risk. It just establishes how we're going to monitor going forward the funds that would be entrusted to that agency. And the second thing we're going to look at in terms of the risk assessment is the request itself. Reimbursing someone who has made a purchase of personal protective equipment is not a high-risk award for you to make. Someone that has made purchases and has planned future expenditures is a little more risky, so we're going to want to know how do we establish additional monitoring on those types of requests. So it's how do we mitigate whatever risks we see as our internal auditors look at both the applicant and the request. And those are beginning now to come in on the online application process. Aaron will take you in a little deeper dive in what the website looks like, what the application process looks like. But that's where we are today, where we hope to end up on August 12th. And then we have a rolling application process and a rolling award process that we'll be presenting to you on a weekly basis. So I guess if you have any questions, I'll be happy to answer those at this time. And if not, we can take a deeper dive into the website.
Commissioner Cruz?
Thank you, Chairman. So I just want to clarify the expenses that people are applying for, the requests that people are applying for. Will they have to spend that money up front to get reimbursed? Or are they going to tell us what they need? We're going to give them the money, they're going to purchase it.
We could do it either way. Some of these expenditures have been made. If I look at a municipality, for instance, they've spent money to date, but they have planned future expenses from now to the end of the year. So we might provide them with some funds initially, and then as they bring us receipts for additional purchases going forward, we could reimburse them. So, I mean, we can take it either way. It's a little riskier to hand over the funds and then have people make the purchases. And if so, we're going to give them guidance on terms of how to follow purchasing protocols so that uniform guidance or our Charter 68, which would govern our purchasing protocols, we're going to require them to follow those protocols as well. Because at the end of the day, when the Inspector General comes in and looks at this, we don't want to owe any money back.
Okay, so it's not necessarily you have to spend it and then get reimbursed. It's the risk factor in which you're going to have. I mean, is like a number on a scale? And I mean, how do you determine that? You said local government or level of fiscal governance, prior acceptance of grants, the monitoring of requests, those kinds of things.
Mm-hmm. Let's say I go in, I'm a social service agency and I make application, but I'm a very small agency. Maybe I may be the only full-time staff person there. I'm not subject to audit. I've never dealt with these kinds of grant awards before. I'm a little higher risk applicant, but I've made eligible purchases and we want to award the money. You agree that we should? It just means that we'll establish some monitoring for them. Or if they're going to purchase something and we agree to fund that, then that might be something where we would step in and say, these are the purchases. This is how you get the best deal on what you want to buy. This is the purchasing protocols you need to follow. So it's a fair, open process. And then, because we don't want them to buy it from a friend or do something that then would not pass muster when it's being audited. down the road a couple of years from now.
Okay.
So we're going to give them guidance to get through that process. It may sound onerous, but we'll provide them with some help and some guidance along the way. This is what you need to do to have a fair open bidding process or fair procurement process that meets the guidelines.
Okay, thank you for that clarification. So you're meeting with the stimulus review team this Thursday for training. When will the first, and then you're going to say applicants come in today or applications come in today. I missed the first part about how quickly this is you're gonna cut it off on a certain day per week.
Yes.
Can you just run through that real quick?
Okay. So kind of the timeline that we have developed at this point, applications would come in, we'll summarize the information, do a risk assessment. Now, some applications may take a little longer to complete the risk assessment, or maybe follow-up stuff would come back. Once that's ready, then by Tuesday of a week that we have applications ready to go and the risk assessments have been completed, that information will be provided to the financial stimulus team, review team. They'll meet on Thursday after they've had a couple of days to look at it. They'll then make recommendations to you.
The following Wednesday?
Yeah.
Okay,
So then by Monday, we'll give you the packet. These are the recommendations from the review team.
okay.
So you'll have a couple of days to look at them as well before having to make that decision on a Wednesday.
So if people fill this out and our financial team contacts them, they should get back with you as soon as possible?
Time would be of the
Yeah,
essence, yes.
okay. Okay. Awesome. Well, I appreciate your work on this. I know that this has been a lot of work, and I'm looking forward to checking out the application.
Yeah.
Okay, please proceed.
Okay. Aaron, I think you're up.
Morning, Commissioners. Aaron Norton, Department of Finance. Before I dive into the actual application for the Fair Cares funding, I also wanted to bring your attention to another document that we have out right now. It is a business survey, very similar to the NOFO that we had out last month, and it is available right on the homepage of the county's website, Business Needs Assessment Survey. This will be open until this Friday, and this is basically giving us a snapshot or an idea of what businesses in the community are needing. And as you all know, we received some additional funding from the state to go into the CARES funding, and this will help us with the programming of that. So this is available until Friday, and we are encouraging everybody out there to fill that out and to let us know. With that said, the CARES funding application is also available on the Sedgwick County website. Up here in the banner area, you can see the CARES funding application. What's great about this is that you won't, if you're filling this application out, you won't need me there. We've actually come up with an application guide that breaks down everything that I'm going to show you over the next few minutes. Do a handy-dandy step-by-step, including some photos and some emphasis on essential fields. So that is right there on the main page. And then also, we'll go back there. Also on this main page, this breaks down what the social services and public health care application actually is and gives you a better idea of whether or not this is what you need to be filling out as an entity. It kind of also gets into what the Sparks Fund and the CARES funding does and how it needs to be used. So there, again, this is for the social services and public health care application. There is a separate process for municipalities and for schools, and we'll get to that in just a few minutes. So here is the CARES Fund application itself. Here's the portal. You've got that call to action button right there to complete the application. Important. Once you start the application, you cannot come back to it. You need to have all of your information right there available with you so you can fill it out at that time. Yeah, it takes about 20 to 30 minutes depending on how detailed you want to get. Once you get in there, you'll see that several of these fields have asterisks up there. These are the essential fields that need to be filled before you can move on to the next one. So just to walk you through this and kind of give you an idea, I'm going to just not bore you and actually do any real ones, but in that drop down you'll actually see social service provider, healthcare provider, entity category, nonprofits, for-profits, healthcare provider. A lot of these fields are actually dynamic and will change depending on what you put in fields above. So. One of the most important aspects of this is the budget of the entity that is applying. This will be used in the risk assessment, as Brent mentioned.
By budget, do you mean how much they're asking for?
This is their total budget for the organization.
Okay, so once they start this, I don't know, I didn't see, do you have to have federal tax ID number, your NAICS number, or anything like that?
Yeah, that is coming up.
Okay, so if somebody's starting and then they don't have that number, and if then they realize I gotta put in a budget, if they don't have that, they gotta just stop and then start over another time?
Correct. If you leave the form, you have to come back and completely start over.
Is there a list that they could look at of all the information that they need before they start this form, that they could know all the information they're gonna have to have?
In that PDF that I mentioned earlier, it tells you everything that you need.
Okay.
And breaks it down and shows you exactly what information you need. So I would recommend that any entity look at that PDF before.
Can you put that at the top of the application? Before you start this, please make sure you have all the information that's gonna be asked. Click here, you can print it out.
Absolutely. We can.
I don't know, maybe, I know I wouldn't wanna get stuck on this application
Yeah.
and have to go back and find it, so.
Yep, we can absolutely make that change. So, back to that. Again, this is also essential, your authorized representative. This is our point of contact if we have any further questions. And you're going to be asked if you've received any other type of assistance, including FEMA, small business loans, anything like that, because again, that'll be part of the risk assessment and will be part of the discussion when it goes to our review teams.
Can you read those as you go along? Would you mind? Because I can't see that.
Absolutely. We have FEMA public assistance. We have Small Business Association loans. We have Health and Human Service funding. And then any other financial assistance received. So that would be any type of other public grants or any sort of other outside funding.
Okay.
And in each one of those fields, you'll actually have the opportunity to elaborate on what you've received, how it's used, and how your response to COVID has been affected. So this is another very important field right here, adjustment of delivery of services. This lets us know exactly how you have been impacted by COVID-19 and how essential additional funding is. Here again, you'll have that narrative where you can break down how you've responded and what you're needing, including cleaning equipment, if you've changed your facility to meet CDC guidelines, if you've had to get any new technology to accommodate working from home or telecommuting, anything like that, since all of those fall under the actual definitions of acceptable use of care spending.
So Aaron, to that point, is there a list somewhere, Lindsay, of acceptable use of CARES funding? I mean, is there a document that we can provide to folks of every single thing that's acceptable use?
Yes, and that actually is outlined in our COVID resources page and on the financial page, but we can make a link to that so that it's highly visible and more accessible.
Cool, thank you.
So, again, more narratives on what you're seeking and what type of programming you're wanting to use the CARES funding for. Again, when we say that this will take about half an hour to fill out, this is where most of it's going to be spent, really breaking down, because the more information you give us, the better explanation you give our team, the more speedy we can make this. Again, another situation where, especially for the public health entities, where you can break down exactly how COVID has affected your organization, if you've had to close down, if you've had to send any employees home, anything like that. As Brent mentioned, one of the things that is going to be weighed is how much experience your organization has with dealing with grants and whether your staff is readily available to handle that. This is where we find that information out. You can elaborate on what sort of grants you've received in the past. You can elaborate on the skills level of your staff when it comes to grants. If you've had any sort of turnover lately, or if you've brought on new staff to accommodate for COVID-19. This is the area that breaks down into more of the financial management aspects of it and the auditing. The reporting is going to be a huge aspect of this. So again, the more elaborate and precise you can be, the better. And there you are. At the very end of this, after you submitted, you'll be taken to this page that says that we have received it and that you can finish there with your call to action button. Once you've done that, it actually takes you back to there. So if you have any other questions or if you need any further data, you can read through that again. You can bring up that PDF. I'd also like to mention that you could email me personally at sedgwickcares@sedgwick.gov, and I can provide any sort of questions or further information that you need. We also have a fantastic team that is available for these types of answers. Once that application has been put in, we go to another site, and I'm so happy that this is still up and working. I got here early to make sure that it would, and I was really concerned. This is Salesforce, which we've received to help manage any of these applications. And this is actually going to be especially important for the municipalities and the school districts, because they will not have to fill out one of those applications that we just walked through. We will be reaching out to them through email to let them know that they can log on to this site and create a new account that will then walk them through all the information that they need to enter. As you can see, this is basically a kind of demonstration model. We haven't actually started to prop this up just yet. We need to move some information over, but I'll be able to walk you through exactly what we can use this program for. Anytime we receive a new application, it comes right here to the applications field, so we can see every application right there. And this is basically what it breaks down to. Total amount requested, who submitted the application, what day it was received, and really all the information that our teams need to start making any sort of decisions. We can also print this out, which is really nice. From there, this is what the schools and the municipalities will see when they're prompted to start a new account here. This is the registration page. Again, not much to see just yet. From the accounts, this is where we can start to really manage things. We can see who has already applied. We can see what type of information that they've given us. They have all their contact information. Another essential element is the budget, as you asked before. This will be kept in line with all their applications so that if they make multiple requests, we can see exactly how much money that they've received, and it adds up and is kept track on this page. As we've also allocated a certain amount of money for each programming element, whether it's schools, public health, we can also see the drawdown on that from this to see exactly how much money is going out, or how much funding is going out, and keep track of it that way. From there, we got reimbursement requests, so you can actually see exactly what is being requested and what money has been spent by these entities. This will be the area where they do their hardcore budget breakdown, sorry. You can see the approved costs. So everything that has been submitted and approved, whether by you or through other means, will be right and kept track in here. When the payments went out and when payments were received. And finally, the reporting. This is a particularly robust system, so we'll be able to do several different types of reporting, whether it's weekly, bi-weekly, by entity, whether it's breaking down from municipalities, schools, public health, or by requests. So, with that in mind, that is everything that I have to show you. And if you have any questions, hit me.
Commissioner Cruz?
Thank you. So on the website, the only, because I'm on here right now, when we did the notice of funding opportunity request, there were 5 entities, right? So governments, educational institutions, social service, business, and other, right? Wasn't there 5? Were those the 5?
Correct.
And so when you go here now, there's only 1. So now go back to this page,
Sorry.
where someone would go to apply. Not the business needs assessment. Yep, there you go. So, you said governments and educational institutions will be sent an email.
Correct.
The other portion and the businesses, should we identify how they apply for that on here? I mean, if you're a social service provider, it's easy, you see that, but you see what I'm saying?
We can do more of a breakout and elaborate on what we have here to, yeah. Lindsay, you want to hand this over to Lindsay?
Good morning, Commissioners. So that notice of funding opportunity was just basically a needs assessment to help us identify what the greatest area of needs were. And as we talked about when we were putting together the spending plan that we brought to you, there were more needs than we had dollars. And so what was identified with the $99.6 million is funding for those highest priority areas. And for now, that includes the social services, the healthcare providers, the cities, and the school districts. To Aaron's point about the business needs assessment, we also know there's a tremendous amount of need there based on that other category that was included in the NOFO. And so that assessment now is going to help us identify programming for that $9.3 million. And whether we choose to use the same application or some other process, we do have a tighter timeline on getting that money out the door than we do our own. And so we're still in the process of developing that program. It may or may not have a link on this page.
Okay.
Does that answer your question?
Yeah, I think that there's some confusion floating around in our community about, if we say our form is open, but only social service and public health can apply. Okay, thank you.
Mm-hmm.
Commissioner O'Donnell?
Lindsay, don't leave quite yet. Because I don't know if it's you or Aaron that needs to answer this question. But when we're talking about K through 12 and we're talking about public schools, so they're getting a pot of money from the Kansas Department of Education and the governor. So wouldn't we request that they apply for that money before they apply for the money that we're getting here?
So, Commissioner, it's interesting that you bring up that question because just yesterday we spent some time doing some analysis looking at what other funding pots are coming and what the state is offering because they had about a 4-hour SPARK committee meeting yesterday. Now, what I heard from that SPARK committee meeting is that the governor actually has not allocated anything, the SPARK committee has not allocated anything specifically to K-12. They have some early education money, they have some higher education dollars, but basically what they're relying on is the fact that school districts did receive some additional funding, $20 million in our community for the 10 school districts that are headquartered here in Sedgwick County.
$85 million, I think, from across the
Right,
state.
grand total, $20 million for our 10
10
school districts. And so the bulk of that, of course, going to City of Wichita. And that was tied to free and reduced lunch counts. So
That's all the money's for?
I don't know that it's all it's for, but that was what it was based on. And so each district here in our county actually received a different level of funding per student. And I'm happy to share that information with the commissioners.
Commissioner Dennis sent that to me the other day.
Okay.
We got it from Dr. Watson.
Okay, great.
So I think we all have that. But I was just wondering if we need to figure that out just to say, hey, the school districts need to stay on this path for money while other entities come to us, if we need to just have that as our own guidelines.
Well, and I think we can continue to have that discussion as we refine the spending plan. At this point, we'll get that intake form that goes out to the school districts and the cities. We'll get a better idea of what the true need is there based on the program categories that are defined. And then depending on what that feedback looks like,
Okay.
we'll come back to you all and seek that additional guidance.
Okay, thank you.
Sure.
Okay.
Any other questions?
I don't see any.
All right, thank you very much.
Thank you.
Chairman, still here? Yeah, Mr. Bennett's still here and would like to come and talk about some of the stress on court and kind of the continuation of the discussion we had with Judge Gehring last week. So, Mark?
Morning, Mark.
Morning.
So I'll make this fairly quick, but I know that as the council, as the commission struggles with how to reopen the courts, the courthouse, how to spend money associated with this COVID relief funding, that this struck me as an opportunity to at least put something back on the in front of the commission. And that has to do with this notion of the traffic court. I think you're all familiar with the fact that over the last 6 weeks or so, we've had traffic court being held out in the pavilion, out in front of the courthouse, out of doors. It's a mechanism for us to try to limit the backlog or reduce the backlog, mitigate it in some fashion, because without court being held on a daily basis at the same pace, same volume that we had in the past, our cases are building up, and traffic, which we file about 20,000 traffic tickets a year in Sedgwick County from all around the county. That's a whole lot of cases to just leave sitting idle. So this has been the best bad idea we could come up with, I suppose, is to have traffic court outside. It has worked, and to the credit of both the citizens and the staff members, we've made a go of it. But some days it rains, it's particularly hot. It's not something we can expect people to stand outside in three in the afternoon when it's 105 degrees. Also, realistically, it's not going to be something viable through the fall as the temperatures begin to fall, to go down. So, if COVID goes away and is, something is some sort of this sort of shot that can be given to people that to boost immunities, and we all feel that we can go back to normal by October, then maybe what I'm about to say is premature. But I've not heard anyone talk like that at the national, local, or regional level. And the reality is, I think we're going to be contending with COVID and its fallout for months to come. And so, as we think about that and think about the volume of cases that Highway Patrol, the Sheriff's Department, and even the police departments around the county bring into the traffic system, the next thing I want to get on the agenda while you're thinking about how to spend this money is what to do with the traffic division, because it is far and away the source of the most foot traffic in the courthouse as people come in and deal with their traffic offenses. Now we could, there may be some other way to do this, but the best idea we have come up with is one that actually goes back to 2017 when we first began to discuss the notion of what to do with the courthouse and would we remove the Register of Deeds and the treasurer and clerk, et cetera, from the courthouse and reimagine the courthouse. And I understand that's been tabled for the moment. That's an ongoing discussion. But I would want to point out that the notion of a traffic court being held on the first floor in Linda Kazier's footprint now, I think has merit right now in the discussions you're having right now about how to spend this COVID money. I want to say to begin with, I spoke to Linda about this, and I did want her to think I was coming in trying to kick her out of the courthouse when that is still in flux. She understands. She said basically, just don't leave me homeless. I got to have a place to do business. But so that's a part of this, and I don't want to overlook that. That is an important part of the discussion we're about to have here. But anyway, I just wanted to get this on your, well, I want to get this in front of the commission. So if I can go to the next slide. Just very quickly, the traffic division being in the center of this diagram sort of gives you an overview of the number of aspects within the courthouse that are impacted by the traffic division. I won't read all of them to you, but it's pretty clear that traffic is a lot of folks, let's put it this way, a lot of folks show up without a lawyer because it's a traffic infraction. They're not going to jail. It's not that sort of a thing. And so it's citizens walking around the courthouse trying to make their way through the courthouse. And these are all of the different entities within the courthouse that are impacted. Go to the next one. And to give you just a kind of another visualization, if you are that person walking in and want to deal with your traffic offense, the traffic courtroom's on the 5th floor, as you know, but here are all the other places you may end up at some point dealing with in terms of the system here. It is far from a user-friendly, simple touch with the criminal justice system. There's a lot of floors to go to. If you want to apply for diversion, it's in one place. If you want to pay your fine, it's on the 7th floor. If you want to go to court and ask for an extension of time to prove that you had your insurance and you just didn't have it the day they pulled you over, that's on the 5th floor. There's adult probations in the basement. I mean, it's a maze for folks to go through, and that's another important aspect of this. And it's what I'm proposing is not only beneficial in other respects, but also just beneficial for the citizens who interact with the system. Next one. Again, this kind of gives you the visual at the bottom of the page is the citizen trying to interact with the traffic system. And it's, again, far from user-friendly here. I won't belabor this. It's been a long morning already, but you get the point. If this looks like a very difficult to follow, that's the point. But this isn't hyperbolic. This is just how it's what it looks like. This is what the citizens face. Next one. So the idea would be this. As we're trying to keep the foot traffic to a minimum in the courthouse, as we're trying to be more user-friendly and something that the citizens, first of all, would appreciate, and also, frankly, just trying to deal with the volume of cases we're going to have, as we have always had in the traffic division. How do we attend to it? How do we do so in an efficient manner? How do we do so without impacting every aspect, or 5 or 6 different floors within the courthouse? How do we do all this and at the same time achieve some notion of social distancing and limiting the impact on county staff, on the citizens themselves, et cetera? It's very difficult at this point to attend to your traffic issues unless you get on an elevator and go up at least 4 floors to the 5 floors to the 5th floor, up 2 more, then ride an elevator again to the 7th floor if you want to pay your fines. So we're expecting citizens to go up and down the elevators in this time when we're trying to social distance and wear masks, et cetera. So, if this is, I recognize what I'm asking here. What I'm at least putting forward is not a simple ask. The first step has to be finding a location for the treasurer's office. Linda can't be, citizens have to interact with her office as well. But we've got 2 spaces basically on the 1st floor. We've got the jury assembly room, which we have to have a place for jurors to go to when we can start doing jury trials again. So that's essentially off limits. The other is the treasurer's office. This was just a quick mock-up that we did. This is not to scale. This is no architect's design. This was just something with a simple plan that my staff put together in 2017. But the idea is just to give you a visual of what it would look like when folks come in the door in October, November, when it's too cold to be standing outside and underneath tents. How would we attend to this, get them in, deal with their business, and get them out? Walk in here you can see it's kind of turned on its side here, but the pay stations are still there. In fact, we could do it in such a fashion that Linda could even continue to have 3 or 4 of those pay stations if that would help facilitate the move. But we have pay stations for folks who want to walk up and say, I got pulled over for a speeding ticket and I didn't have my license. I just paid my speeding ticket, but we have to show that you did have a license. We need to show it to somebody. We have that done. Thank you. We'll dismiss that count, pay your speeding ticket, go on down the road. That sort of quick interaction could be accomplished at that window. They could walk in, go through the metal detectors, take care of it, and be out the door without ever having touched the rest of the courthouse, interacted with courthouse staff. gone through all this maze of things that I showed in the earlier examples or earlier slides. And then the rest of it's pretty self-explanatory. Again, I'm trying not to, I can go through this for an hour, but again, you've had a long morning. But the point is, the room is big enough to accommodate I think everything we would need to do in a traffic court. And toward that back end there, toward the far west is where the judge would be. I understand the courts, Ellen and Judge Gehring, Ellen House and Judge Gehring have weighed in, and I think they've endorsed this notion as well. I don't want to say that they endorse this specific plan. I think they'd like to see more of a judge's chambers toward the very end there. Oh, fine. I mean, I'm not going to parse, get in the hair splitting here, how it looks. But the bottom line is we could, the overarching goal is this. We're trying to be the most efficient courthouse we can. We're trying to make this, no one likes to get a speeding ticket, but at the same time, that the reality is, I always go back to my first month on the job as a prosecutor 25 years ago. My boss at the time, I worked in another jurisdiction. I worked up in Junction City. And my boss told me, your job when you're in traffic court, because the first guy in the door goes to traffic court, your job is to make the experience at least tolerable for the average citizen, because traffic court is where most people have a touch with the criminal justice system. Most people aren't going to be involved in murder cases and rape cases, things like that, but everybody at one point in their life goes to traffic court and has to pay a traffic ticket. And that's the point. That's the impression that the criminal justice system makes on the average citizen. And so, be professional, be pleasant, except that was my marching orders. And I think about that when I think about how the traffic court interacts with the citizens in this county right now. And I think it's unnecessarily burdensome. We could make it a lot more efficient. That's been the message since 2017. I know you've heard it. I know you get it. And the question now is just how to make it happen. I get that. I'm taking the time today and taking your time today to say, while you're thinking about COVID, this has renewed urgency because of the number of people who will be coming in and out of the system, in and out of this building, when we are no longer able to have them stand on the front of the courthouse. Like I said, if COVID goes away by September, I've wasted 15 minutes of your time. But if it doesn't, and we don't think anyone's that optimistic, if it still lingers through the fall and into the winter, into next spring, before there's some, I won't hesitate to use the word cure, but some mechanism for us to attend to this medically, we're going to be dealing with a large influx of folks coming in and out of the courthouse. And I'd rather put this in front of you today than in October going, what are we going to do? Do you want me to just shut the whole system down again for 6 months? I'm not sure that's a viable option either. So, if this doesn't work, and this is I'm not holding the sword of Damocles over your head by any means, but if not, we may be back in the fall saying, okay, well, maybe we do need to talk about maybe using the 4-H building or some other county building, because I think the current system is just not going to be sustainable through the fall. So I think that's the last slide.
Okay, thank you, Commissioner O'Donnell.
Thank you, D.A. Bennett, for all your work and sitting through this morning. We know you're a very busy guy. So would it require, and I had a message from one of our state legislators, would it require legislation to allow traffic court to be done online, like Zoom or something?
Yeah, I mean, traffic court's a little bit different than others because we're talking about typically infractions instead of crimes. Yeah. I hate to use that word because it's as if it's not. I mean, it's an infraction, right. But you have to have a. I mean, let's put it this way: when we reach the level of a Class A misdemeanor, Class B misdemeanor, think misdemeanors as opposed to traffic infractions, then there's constitutional implications. The person has a right to show up and be confronted with the evidence and in an open court and speedy trial, all that sort of thing. Infractions, there would be mechanisms that we could go to allow that.
Would that be a legislative avenue or an order from the Supreme Court that would allow that?
Typically legislation is always the cleanest way to make a change to the law. Under this current environment, the Supreme Court's been given quite a bit of power to do these sort of things, so they could. But I also want to stop for just a second and also say this is a conversation that would also require the input from the courts. So I wouldn't want to speak without having Ellen, Judge Gehring weigh in on this, because if there's a Zoom call for thousands of people, there's got to be a judge on that Zoom call as well. So I need to make sure they're involved. And then the clerk's office and others would have to be cued into this as well, because someone's has to be documenting what just took place on that call. So there's a lot of moving parts to it. But that is, for the speeding tickets, for the infractions, yes. For the misdemeanors, driving on a suspended license, alcohol, in your car, that sort of thing, that, I don't think we could do it there without
Right.
legislative
Okay.
change.
Well, that was a question that I
Yeah.
received from one of our state representatives, wanted me to ask you about that, so I'm sure we can
Sure.
follow up with that. And then I know you're saying time frame, we need this before, obviously, the winter. If we can't get that space, I know we're getting ready, Treasurer Kazire isn't running for reelection,
Sure.
going to go through a transition of power. Across the street at the historic courthouse, is there ability?
There is, with one other caveat, though. Now we're talking about, whenever we talk about moving, and this is a larger conversation, jury trials, et cetera, because that's a huge issue for us right now, so how we get jury trials going. But when we talk about going off-site or holding any sort of court, there are people who have traffic infractions who are also being held on criminal cases
Yeah.
that have nothing to do with, it just so happens that they've got a traffic warrant, and then they got picked up on their rape case or whatever. Security. So now you got to get the sheriff involved in this conversation.
Okay.
So the answer is, it's viable in terms of space. Yeah, we could do that, with the caveat that we don't have security at the courthouse the way we do in this courthouse, and moving prisoners across the street and that sort of thing. It's not a reason to dismiss it out of hand, but there are certain complications with going off of this physical structure of this courthouse.
Okay, thank you.
Yeah.
Okay, Commissioner Howell?
Thank you. Just following up, so can you break down the number of people that access the courthouse due to simple traffic infractions versus other more complicated cases that need to be in the courthouse? You said that other crimes perhaps, or
Sure.
or anything else. I mean, if you break that down, what
Sure.
percentages is?
Well, we'll go kind of macro and then try to get more specific. So the big picture is about anywhere from 19 to 23,000 traffic cases are filed in Sedgwick County each year. Typically, it's the highway patrol, sheriff, and then, like I said, there are other police departments. Most Wichita cases go through the municipal court across the street, but we're still going to deal with, we've got 35 highway, we've got 54, so a lot of traffic. Of those, let's say 20,000, because that's a pretty fair annual average. Luckily, a lot of folks just pay their tickets and don't want to come to court and contest it. So let's just cut that in half. That's fairly arbitrary, but not out of sync year to year over a 10-year look back. So about 10,000 cases then have some requirement. Either the person decides they want to contest it, or, like I said, there's something that they need to provide to us. You were driving on a suspended license. All right, we'll give you a period of time to get that license back. But you come to court and say, I'm still working with the Department of Revenue to pay off my old tickets and things, please, and they get the case continued. And so not only is it just those 10,000 people who are going to be coming into the courthouse, but they may be coming multiple times because they don't want to contest it, but they want to try to work something out. I didn't have insurance, but I do now. I need to show you that. Okay. I want to contest this. I don't have a lawyer. I'm asking for a judge to have the first hearing, then they may be getting a court-appointed lawyer down the road for a more serious charge. So it's not, so I'm using broad numbers here, but I'm going to say on average somewhere between 9,000 and 11,000 people are going to have a hearing, or going to have a case with a TR number, a traffic case, that either requires their presence or they've chosen to elect that option to come to court. And of those, it's not just a single event. They don't just show up one time and deal with it. Some they do, but many are going to have at least 2 hearings, sometimes more than that. You can see some of the pictures that Jeanette handed out earlier. This was back in, I think we took these in 2017, and the point was simply to show how difficult it would be on the 5th floor in the existing structure to maintain anything resembling social distancing because of those numbers. Now, just very quickly, I'm not sure this was exactly your question, but that's traffic. Separate and apart from that is the fact that we have 3,500 criminal cases filed every year, and I'm not talking about that. Those are separated across 10 different judges in the criminal division, and those are going to be the felonies and person crimes, non-person crimes, property crimes, things like that. Something distinct from traffic. Does that get to the heart of your
What I'm
question?
getting to is kind of like what Commissioner O'Donnell was talking about. So I'm trying to, out of the pressure on the courthouse, how much of that could be alleviated if we had a virtual meeting between the judge and the defendant, if you want to think of it that way? They might have to have some support staff at the other end to manage what's happening. But for example, say we used Intrust Bank Arena and set up, if you will, a virtual interface to people in the courthouse, wherever they happen to be. And so there's a virtual meeting that's set up by us. That person parks at that parking lot and appears, if you will, virtually at, using our technology in one of our locations. But there's no security necessarily needed because there's no judge there. It's mostly administrative. It's maybe a way to solve this more timely.
Rapidly, yeah.
Rapidly.
Yeah.
One of the concerns I have here, let me just wrap up the previous comment. I'm trying to figure out how much of that pressure could be alleviated if we had that type of technology available. Because what I see here, in my opinion, is we've talked a lot about the treasurer, deeds, and clerk need to stay together. So if you move the treasurer, you're creating other conflicts by not having the deeds and clerk move with them.
Understood.
Secondly, if we were to do this, it's a very complex challenge to find the right space, to sign a contract, to prepare that space for the staff that's going to move, and then to make the move, and then to set up all the technology, and then we've got to do a renovation to this space. Not trying to drag my feet here, but I think we're talking about a year-long process.
I understand, and I recognize
And that doesn't solve the problem that
Yeah.
you're talking about today about wintertime, which is coming up a couple of months from now.
Yeah.
So if this is not really a solution to a COVID-19 wintertime coming quickly, then we ought to be talking about a temporary solution that really does solve that problem.
So the initial thought, because this has been kicked around, could we do a Zoom WebEx traffic court? It can happen, but the idea of people just logging in from home would be almost impossible because there's no way to verify that the person who's logging in is.
And I wouldn't suggest, I think
Yeah.
we have to have staff and our technology at some place outside the courthouse.
Because people have to sign documents in the presence
Sure.
of somebody, they have to acknowledge things, they have, it's the kind of thing that perhaps if that's I understand what you're saying, that there's an immediacy to this that I'm just not sure even my suggestion today can be accommodated to. This is going to take longer than probably what we'd like. So if we're talking about a short-term solution and the county's going to get behind something like that, my suggestion is we may need a working group between the clerks, the sheriff, the courts, my office. We don't really have a public defender system for traffic court. They're reserved for felonies. But we could get some of the defense bar who typically works in traffic.
Well, let me just
as
say,
well.
I think we need a more immediate solution,
Yeah.
and I think that what I just described, again, relying on our own technology and our own space and putting staff up in some place, that sounds to be very doable, and I would be surprised if CARES money didn't take care of the cost of that. This other plan's been kicked around since, you just said 2017.
Yes, sir.
I would be a little surprised if we could use CARES money for this. Doesn't mean it's not a great idea.
Yeah.
I love the presentation. I think it's a great way for us to go in the future. I just think that the immediate concern about COVID-19 and the winter months coming up, the fact that this plan has been out there for several years now, I would be shocked if we could do this quickly enough and whether it be qualifying for CARES money anyway. Again, if we believe this is the right configuration, I think this is a great proposal, and I love the idea. I just don't know that this qualifies for a solution to the problems we're experiencing or for that money that seems to be on the table for things like this.
Understood. It's a loaded question. There's a lot to consider. I wanted to get this in front of you now, number one. I guess I could make the pitch for why CARE money should at least be, maybe an architectural scheme could be paid for with this. I recognize, though, that I'm not here so much to argue for a particular expenditure. I just wanted to make sure you were aware of this. But I agree that long-term versus short-term there's two different considerations. The long-term solution, I think, is what I've personally shown you. Can we accommodate this in a reasonable amount of time and attend to the issues we're going to have this winter? I recognize that's probably overly optimistic. But I'd also point out that there is an urgency to this. I don't know that we can put off this notion of a traffic court being on the first floor for a few more years. I think COVID has shown us that something can come up like this disease. It could be another one. COVID could last 18 months. So, I still want to put the foot on the gas here, but I recognize your point that Zoom or WebEx or something else that could be utilized in the shorter term to accommodate is certainly a conversation worth having.
Your final comments I agree with completely. I think we ought to have a better configuration for the courthouse, and this is a very good proposal. But let me encourage you and your staff to please look for a technology solution, as I just described a minute ago. Maybe that's not exactly the right thing, but you get the idea. I think that has to be something that's developed pretty quickly because, again, winter's coming. Thank you.
Yeah. And last I'd say, just in defense of my staff, they'd be kicking me going, don't let them think we haven't been. They have been having these conversations, and if I was talking about a working group, in fact, there's been meetings regularly between my staff, the courts, and others, talking about this very issue. What are we going to do? That was the genesis of the outdoor court, traffic court. It came out of that working group. So,
Commissioner Dennis.
Thank you, Mr. Chairman. Well, thank you very much for being here today, Mr. DA. I appreciate it. I agree that we need some kind of a very quick, temporary solution. My windows and all of our windows look out over the front of the courthouse, and I see the 5 tents that go up about 3 times a week, and temperature goes up, weather comes in, rain. We've got to get the folks out from little tents out in front of the courthouse. So I agree that we need a temporary solution, and in the very near future, because I don't know that the solution with the tents is the best solution that we can come up with. I've already talked to the manager a little bit about it to see if we could use some other facilities that we've got here in Sedgwick County to be able to do that. The one answer that you gave to Commissioner O'Donnell, you're not bringing prisoners out front, are you? You're handling them separately, right?
Correct.
So if we had some other temporary location, we could still handle the prisoners and so forth separately.
Fifth floor, yes.
The big bulk of it are the day-to-day things that we're able to handle out front. So I think if we can get a temporary solution to fix the problem that I see, and that's putting our staff out in front in all kinds of different weather, is not a good solution in my opinion. So I'd be very happy to have our staff work with you all to find out what we can do to get it immediately done. And I realize that ever since I've been on the commission, we've tried to solve the courthouse problem, and we've got 5 different commissioners and 10 different ideas on how to do that. So at some point, we're going to have to make a decision on what we do with the courthouse too. And maybe this will give us the impetus to finally start making some decisions for where we're going to go with the courthouse in the future. But I appreciate you bringing this to us. I think we need an immediate solution to get the people out of the weather.
Yes, sir.
Thanks, sir.
Okay. And I'm supportive of the staff of trying to look into this right away. If we can get it done, if it works, we can make a decision. Okay, thank you, Mark.
Thank you.
Yes, sir, Tom. Next.
Chairman, I think we can talk about the lobbyists next week due to the length of time from today. So that's all we had to present today, sir.
Okay. Don't see any other lights on, so we will adjourn and see everybody tomorrow.